taking vaccines. For example, hepatitis A and B can be controlled by vaccinations, while hepatitis A and E can be controlled by safe drinking water and by avoiding taking contaminated food and water from outside foods and restaurants. While mother to baby transmission, especially of hepatitis B, can be transmitted by prenatal checkups and also by vaccination and immunoglobulin to the newborn babies to prevent transmission of hepatitis B. Hepatitis B and C in India are also predominantly transmitted by contaminated needles, blood and blood product transfusion. So this can be avoided by safe practices by avoiding injections from quacks and non-medical personnel, and also avoiding unnecessary component and blood product transfusions. There are very safe and effective medicines that are available for hepatitis C virus. To identify these are those at risk for hepatitis, like newborns to infected mothers, those who are living in a very high prevalence of hepatitis B and C viruses, those who are IV drug abusers, and those who have family members who have viral hepatitis. These people should be screened for hepatitis viruses and should take vaccination for hepatitis B. And if they are hepatitis C positive, they should consult a gastroenterologist and start taking antiviral medications for hepatitis C.
Hepatitis refers to inflammation of the liver. It can happen from several causes such as viruses, such as hepatitis A, B, C, D and E, certain toxins such as alcohol and medications, also certain conditions of the liver such as autoimmune hepatitis and other rare conditions can cause hepatitis, which is inflammation of the liver. Depending on the cause of the hepatitis and depending on the stage of the hepatitis, symptoms can vary. Some of the most common symptoms of hepatitis could be jaundice, which is nothing but yellowish discoloration of your skin and your eyes. It usually happens because of excess bilirubin production, which comes from degradation of the red blood cells. Some other symptoms such as fatigue, which is extreme weakness, and listlessness or lack of energy is one of the other principal symptoms of hepatitis. There are several other symptoms such as abdominal pain, specifically in the right side of the upper quadrant of your abdomen. That is one of the symptoms. Dark colored urine because of excess bilirubin in the urine is also one of the symptoms. Pale colored stools because bilirubin does not reach the stools. Nausea and vomiting also is one of the symptoms, eventually leading to fatigue, weight loss, loss of appetite. Fever also can be a cardinal symptom, especially with viral hepatitis. There are some other symptoms such as joint pains, which is, although non-specific, can be associated with hepatitis. Pruritus, which is itching of the skin, also is one of the important symptoms that can occur with hepatitis. Although these are some of the most common symptoms of hepatitis, quite a few times hepatitis or inflammation of the liver can be asymptomatic depending on the cause of hepatitis. Hepatitis, like we discussed, is nothing but inflammation of the liver, can occur from several causes such as viruses, toxins, alcohol and several other causes. Usually asymptomatic, but quite a few times can develop symptoms, and if left untreated can lead to some severe life-threatening complications. Some of the complications would include liver cirrhosis, which is irreversible scarring of the liver leading to fibrosis, and eventually cirrhosis, which is nodular shrunken liver, where the functions of the liver are impacted. As a result of which blood flow through the liver, the several functions of the liver are affected and the liver cannot do what it usually does. Some other complications of hepatitis, which can include liver failure, where the liver ceases to function and all its functions are hindered. Hepatocellular carcinoma or liver cancer is also one dreaded complication of liver failure, as a result of which patients can develop a nodule in the liver called hepatocellular cancer, which can actually eventually spread to different organs in the body. Acute fulminant hepatitis is another condition, especially with conditions such as hepatitis A, B, which causes an acute liver failure condition which requires emergent treatment. Other complications of hepatitis, if left untreated, would be portal hypertension, which is a condition where the pressures in the abdomen between the liver and the spleen increase due to high pressure states, as a result of which we can develop conditions such as esophageal varices, which are blood vessels that swell up in your food pipe or the esophagus and your stomach, called gastric varices. When these blood vessels rupture, you can present with blood-colored vomiting or black-colored stool. There are several other complications from this hepatitis, such as ascites, which is fluid buildup in the belly as a result of extravasation and excess fluid in the abdomen, and also lower extremity edema, which is excess fluid buildup in the feet. So liver inflammation or hepatitis, if left untreated, can lead to several life-threatening complications and should be addressed as soon as possible. Getting tested for hepatitis is essential for several reasons, especially as hepatitis is a group of viral infections that can have serious health consequences. Some of the key reasons why you want to get tested for hepatitis is because early detection of hepatitis B and C can have very good consequences on the patient, where you can actually prevent progression to chronic liver disease. Early detection can also help prevent complications of liver disease such as liver cirrhosis. It can also prevent transmission of hepatitis or the viral hepatitis from one person to the other. Early detection of these hepatitis can actually, especially in cases of healthcare workers, prevent transmission from the patient or the healthcare provider to other patients. Early detection of hepatitis can help in getting a good treatment regimen for these patients, so that they can prevent the virus from transmitting. They can prevent the virus from creating long-term complications, and can also prevent the viruses from causing long-term sequelae in the liver of the patients. Hepatitis, like we discussed, is a condition where there's inflammation of the liver, swelling of the liver due to viruses, alcohol, toxins, autoimmune conditions. So the treatment of this specific hepatitis depends on the actual cause of the hepatitis. For instance, in the case of hepatitis A or E, they usually are self-limited, and supportive care in the form of IV fluids, parenteral nutrition, certain supportive medications to decrease the fever, decrease diarrhea, and all these conditions, monitoring electrolytes, would be the key of treatment. In conditions such as hepatitis B and C, antiviral treatments such as nucleoside or nucleotide analogs, direct-acting antiviral agents, all these are treatments, and previously interferon and ribavirin are some of the treatments that were used for treating hepatitis B and C. Depending on other conditions that cause hepatitis, such as autoimmune hepatitis, steroids or immunomodulator medications are usually used to treat these conditions. There are some other conditions such as Wilson's disease, hemochromatosis, and others that can cause chronic liver disease, the treatment of which would vary. Some other treatment modalities of this hepatitis would include supportive care, giving a high protein diet, controlling the salt intake, giving water pills such as diuretics, and all these medications to prevent complications from the liver disease would be the mainstay. In case of advanced disease from hepatitis, liver transplantation would also be one of the most commonly used regimens. Along with this, you also treat the complications that develop from hepatitis, such as endoscopic variceal band ligation, or TIPS procedure. These are some of the things that we engage in to treat the complications of hepatitis. So in general, I would say, depending on the cause of the hepatitis, the treatment would vary, and early detection and early determination of the cause would help in finding the appropriate treatment regimen and the treatment course. So the importance of following a treatment plan for hepatitis would include, first and foremost, viral suppression in the case of viral hepatitis. If you have hepatitis B or hepatitis C causing chronic liver disease, it can actually suppress the virus, preventing long-term complications such as liver cirrhosis. You can actually prevent further complications such as portal hypertension, preventing liver cirrhosis or fibrosis, preventing liver cancer also are some of the things that help when you take early treatment and you actually follow the treatment plan, you can prevent liver transplantation in these patients. When you also follow a treatment plan, vaccination also could be one of the things that should be considered as one of the things that can happen when you follow the treatment plan. So in general, when you follow the treatment plan, not only can you prevent liver disease, you can actually target the virus or the causative agent early on, you can prevent complications, and you can also act in a manner that you can prevent long-term liver failure, or you can prevent liver transplantation as one of the treatments for liver failure.